Hi, I'm Dr. Lisa Barr of the Barr Center for Innovative Pain and Regenerative Therapies. At Barr Center, one of our focuses is innovation. And I've been in practice for 40 years, but I'm the first physician in Virginia to be doing regenerative medicine. Over the course of the last 30 years, we've seen a lot of changes in the area of regenerative medicine. So you may think of regenerative medicine as PRP. People know that professional athletes get PRP to resolve pesky extremity issues and spinal issues. And PRP is one of the mainstays of our regenerative medicine program. But we also offer unique treatments such as prolotherapy. And we find that the prolotherapy is very beneficial for people who have whiplash injuries and ligament laxity due to hypermobility issues. So there's some basic differences between prolotherapy and PRP. So the PRP is extremely effective in people that have arthritic joints, who have tendon tears, tendinitis, bursitis, as well as spine-related pain. So each modality has its unique benefits. We also have the ability to do platelet-rich fibrin matrix, which is PRP plus. And what we do is by adding some calcium to the mixture, we can cause your PRP to become more viscous. And that means it's thicker. So when we inject it under ultrasound, say in a torn tendon, it will tend to stay where we put it longer, releasing the growth factors in the PRP so over a longer period of time to promote a longer window of healing. When we do PRP, it involves drawing a small sample of your blood and then spinning it down in a special centrifuge. That centrifuge separates out your red blood cells from your white blood cells and also further separates out certain white blood cells from other white blood cells. Our unique PRP system is a monocyte-rich neutrophil pore system, which actually takes some of the inflammatory white cells out. Then we can determine how much of the platelet-rich plasma we actually need to treat you, and we can obtain really strong platelet-rich plasma. Then under ultrasound guidance or X-ray guidance, depending on your condition, we can then inject this platelet-rich plasma, and what's fascinating is what happens after the injection. So any regenerative medicine procedure, whether it's prolotherapy, PRP, bone marrow-derived stem cells, or fat grafting, which are all, or platelet-rich fibrin matrix, all of these modalities work in the same way. And how they work is they stimulate the body to heal itself, igniting a normal cascade of healing, which starts with a brief period of inflammation, followed by the proliferation of collagen, followed by the remodeling of collagen. This, after each regenerative medicine procedure, you can expect a 90 to 100 calendar day healing window. And we guide our patients through that process. And so most of our patients do well with one injection, but sometimes you might require more than one, depending on the severity of the condition. In addition, we have a laser rental program. That cold laser rental program allows our patients to take a cold laser home to even accelerate the healing from a regenerative medicine procedure. It is really fascinating to know that in our system, in our blood, are circulating growth factors. These circulating growth factors really just travel throughout our body. So the way regenerative medicine like PRP works is that we concentrate these growth factors into a small amount, and then we inject that concentrated dose of growth factors into an area that needs help. So these growth factors increase blood flow into the area. These growth factors stimulate wound healing. There is a myriad of different growth factors, hundreds of growth factors in our own blood that work. In addition to doing prolotherapy and PRP, there are patients that, for whatever reason, sometimes they're on a blood thinner. Sometimes they have a low platelet count. We do have the ability to do non-autologous regenerative medicine utilizing Wharton's jelly type of product or amniotic-derived stem cells. in our experience, growth factors work pretty much the same. And we tend to lean toward using prolotherapy and PRP most often because it's the most cost-effective modality. But if the patient needs a non-autologous type of regenerative medicine procedure, then we can easily go to the amniotic tissue or to a Wharton's jelly type of product, which then doesn't require us to draw blood from or take any stem cells from the patient. So I hope you find this regenerative medicine information helpful, and if you have any questions, we'd be happy to see you to see if any of our regenerative medicine therapies would benefit you. Thanks.